Okay, so you ready to dive in? Today, we are going to talk about something called cyclodextrins.
Oh, yeah, I am.
Cyclodextrins. You probably have never heard of them,
Nope.
but you've almost certainly swallowed a few.
Oh, really?
Yeah, they're in a bunch of different medications. And I think a lot of people, when they look at that ingredients list, they just kind of gloss over anything that's not the active drug, right?
Yeah, I'm definitely guilty of that.
Yeah. So we're going to do a deep dive on cyclodextrins today, going through a bunch of research and some regulatory documents.
Right.
And I think this is particularly interesting because, the safety of these things is kind of dependent on how they're administered.
Oh, interesting.
Yeah, and we'll talk about that a bit. But let's start off with, the basics. What are cyclodextrins?
Well, you can think of them kind of like tiny little containers, these little molecular, almost like a molecular donut. And the way they work is they can trap other molecules inside of them. And this is really important for medications because a lot of medications don't dissolve very well in water.
Right.
And so if you can trap them inside the cyclodextrin, it allows them to be formulated into a liquid or to be absorbed better in the body.
So it's like it makes the drug more bioavailable, is that what you're saying?
Exactly.
Okay. And so our main goal today is going to be to talk about the safety of these compounds because, anything that's going into our bodies, it's worth understanding, what are the potential downsides? What should we be aware of?
Yeah, absolutely. And what's really cool is, these things can be given all sorts of different ways, right? They could be in a pill that you swallow, or they could be inhaled. They can even be given intravenously.
Right.
And that actually has a really big impact on their safety profile.
Mm-hmm.
And then the other thing that we're going to talk about is, there are a lot of different types of cyclodextrins, and even small changes to their structure can have a big impact on how they behave in the body.
Okay, so you're saying the different routes of administration and then also the different chemical structures, the different types of cyclodextrins will affect their safety profile.
Exactly.
Got it. Okay, so let's start off with probably the most common route of administration, which is, people swallow medications, they take them orally. What do we know about the safety of cyclodextrins when they're taken orally?
Well, when they're given orally, they actually have a really low bioavailability, meaning that very little of what you swallow actually gets absorbed into your bloodstream.
Well,
It's typically, less than 3%. There's one exception mentioned in our sources. It's a modified type called RM-Best-CD, and that one showed a little bit better absorption. It was about 12% in rats.
okay, so for the most part, very little of it is actually getting into our systems when we swallow it.
Exactly.
Okay. But they must be doing something in our digestive system. What do we know about that?
Yeah, so even though they're not really being absorbed that much, they can still have an effect on the drugs that you're taking. So, as I mentioned before, a lot of drugs don't dissolve well in water. And so with the molecule and help it dissolve in the watery environment of your gut.
Interesting.
And so that can actually increase the absorption of the drug and make it more effective.
So it's almost like, we all know that sugar dissolves in water. It's kind of making those drugs more like sugar, more soluble, more able to be absorbed by our bodies.
Exactly. It's like putting it in a little package that your body can then absorb more easily.
Okay, that makes sense. And so for you, if you're, taking a medication that has cyclodextrins in it,
Yeah.
is that something you should be concerned about?
Well, the good news is that most of these cyclodextrins are considered generally safe, or what we call GRAS, when taken orally. And so, the typical doses that you would find in a medication are not going to cause any problems. Now, of course, like with anything, if you take really, really high doses, you might start to see some side effects.
Okay.
But that would be, far beyond what you would normally find in a pill.
What kind of side effects are we talking about here?
Well, some of the things that have been seen in animal studies are like diarrhea or changes in the size of the cecum, which is part of the large intestine.
Okay.
But those effects are usually reversible, and they tend to go away once you stop taking the cyclodextrin. And the thinking is that it's probably just a physiological response to having a lot of this poorly digestible carbohydrate in your gut.
Okay, so basically, your body's not used to digesting this stuff, and it's like, whoa, what's going on here?
Exactly, yeah.
Okay, and so, the sources also mentioned some acceptable daily intake levels for some of these cyclodextrins. Can you talk about that a little bit?
Yeah, so for example, alpha-cyclodextrin, the acceptable daily intake as a dietary supplement is up to 6,000 milligrams.
Okay.
Beta-cyclodextrin's a little bit lower, 500 milligrams.
Okay.
And then gamma-cyclodextrin is up to 10,000 milligrams.
So that's a lot, right?
Yeah, those are pretty high amounts.
Yeah.
And that just kind of speaks to the fact that, they're generally considered to be safe when taken orally.
Okay, so it seems like, for the average person, you see cyclodextrin on the label, you're probably not going to have to worry about it.
Exactly, yeah.
Okay. So let's move on. You mentioned that the route of administration can really affect the safety profile of these things. So let's talk about nasal and pulmonary administration. So what happens when you breathe in cyclodextrins?
Yeah, so when you inhale these things, they can actually have a different effect on the body.
Okay.
For example, they can increase the permeability of mucous membranes.
What does that mean for you?
So what that means is that they can actually help drugs get absorbed better through the lining of your nose or your lungs.
Okay.
And the way they do that is by loosening up those tight junctions between the cells, or by interacting with some of the lipids in the cell membrane.
Interesting.
And this is thought to be a mild and reversible effect.
Okay.
So, it's not like it's going to permanently damage your nose or your lungs,
Oh, wait, yeah.
but it's something to be aware of. Now, the absorption of the cyclodextrin itself through the mucous membranes is usually pretty low at typical concentrations. But if you need a higher concentration, say to get the drug absorbed properly, then some of the cyclodextrin might also get absorbed.
So it's like, the cyclodextrin is acting like a vehicle, but it's also kind of greasing the wheels a little bit, making it easier for that drug to get in.
Exactly.
Okay. And what about specifically pulmonary delivery? So if you're inhaling a medication that's designed to get into your lungs, are the cyclodextrins being absorbed from your lungs into your body?
Yeah, they can be. So there were some studies in rabbits where they administered cyclodextrins directly into the trachea.
Okay.
And they found that different types of cyclodextrins, including, the parent beta-cyclodextrin and some of the modified versions like RMCD and HPCD, they all had fairly high bioavailability, upwards of 60 to 80%.
Wow. Okay. So, if you're inhaling a medication that has cyclodextrins in it, those cyclodextrins are getting into your system. What does that mean for your safety?
Well, the good news is that, they generally don't cause any major problems in the lungs.
Okay.
There was one study in rats where they looked at short-term exposure,
Okay.
and they found that, at concentrations of less than 10%, the cyclodextrins didn't cause any obvious damage to the nasal mucosa.
Okay.
Beta-cyclodextrin at 1.5% was also safe. There was one exception, though. RMCD at 20% did cause some severe damage.
Oh, wow. Okay. So it's
Yep.
really dependent on the concentration and the type of cyclodextrin.
Exactly. Yeah.
Okay. And do we have any human studies to kind of back this up?
Yeah, there have been some clinical studies. So, for example, there was a nasal spray that contained estradiol and progesterone,
Okay.
and it was solubilized with 6.2% RMCD,
Okay.
and the patients tolerated it well. They used it twice daily for a month.
Okay. So that's good.
Yeah. And then there was another study with HPCD in rabbits, and they found that it was well tolerated up to 10% for 3 months.
Okay. So that's reassuring.
Yeah.
All right. Well, let's move on to a different route of administration. What about rectal administration? So this would be like suppositories and things like that.
Yeah, so cyclodextrins can also be used in suppositories.
Okay.
And similar to nasal administration, they can actually enhance the absorption of drugs from the rectum.
Okay.
And they can also be absorbed themselves. The amount that's absorbed can vary depending on the type of cyclodextrin and the concentration.
So does that mean, we keep seeing this pattern where the modified cyclodextrins seem to be absorbed more than the basic ones?
Yeah, that seems to be the trend.
Okay.
And then in terms of safety, there were some studies in rats that showed that up to 5% of beta-cyclodextrin could be absorbed from oleaginous suppositories,
Okay.
and up to 26% of HPCD.
Okay, so a pretty significant amount.
Yeah. And then there were also some studies in humans and rabbits that showed that suppositories with up to 230 milligrams of beta-cyclodextrin and 12% HPCT didn't cause any irritation.
Okay, that's good.
Yeah. There was one potential issue with alpha-cyclodextrin, though.
Okay.
It was found to increase the transepithelial conductance of rectal mucosa.
Okay, what does that mean for you?
Well, basically what it means is that it can potentially damage the epithelial cell layer.
Oh, okay.
And this was confirmed in rabbits where they saw some partial degeneration and desquamation of the epithelial cells.
Okay.
But the researchers found that if you combine the alpha-cyclodextrin with xanthan gum, that can actually reduce the irritation.
Okay, so it's like it's preventing that alpha-cyclodextrin from from just like sitting there and causing damage.
Exactly, yeah.
Okay, interesting. So, we've talked about swallowing these things, breathing them in, rectal administration. What about putting them on our skin? So, topical creams and things like that.
Yeah, so cyclodextrins can also be used in topical formulation.
Okay.
But they're actually not absorbed very well through the skin.
Okay.
So one study in mice showed that only about 0.02% of HP-BO-CD was absorbed over 24 hours.
Okay, so very, very little.
Yeah, very little. But the absorption can be increased if you use what we call occlusive conditions.
Okay.
So that would be like putting a bandage over the area where you applied the cream.
Okay.
And it can also be increased if you use absorption promoting agents.
Okay.
So there are certain chemicals that can actually help the cyclodextrins penetrate the skin better. And so in rats, they found that with a hydrophilic ointment and occlusive conditions, up to 12% of beta-cyclodextrin could be absorbed.
Okay.
43% of RMCD and 53% of HPACD.
Wow. Okay, so that's a pretty significant increase.
Yeah.
But, if you're just putting a cream on your skin and you're not covering it up,
Yeah.
you're probably not going to absorb a lot of the cyclodextrin.
Exactly.
Okay. And what about skin irritation? Is that something you should be concerned about?
Yeah, so skin irritation can be an issue with cyclodextrins, especially at higher concentrations.
Okay.
So in guinea pigs, they found that the irritation potential was in the order of gamma-cyclodextrin being the least irritating,
Okay.
followed by alpha-cyclodextrin, and then beta-cyclodextrin being the most irritating.
Interesting.
And it's thought that this is related to their ability to extract lipids from the skin.
Okay.
And then in vitro studies using Haycat keratinocytes, which are a type of skin cell,
Right.
they found that concentrations up to 0.1% of the alpha, beta, and gamma cyclodextrins didn't affect cell proliferation.
Okay.
But at higher concentrations, beta cyclodextrin and RMCD did show some cytotoxicity.
Okay, so that means they were toxic to the cell.
Exactly, yeah. And so the general consensus is that concentrations up to 0.1% are probably safe for the skin.
Okay.
And then HPBCD has actually been studied extensively for its potential to cause antigenicity, mutagenicity, and topical irritation.
Okay.
And it's been found to be as safe as the materials that are used in perfumes and cosmetics.
Okay, so that's reassuring.
Yeah.
All right, so we've talked about skin, we talked about lungs, nose, rectally. What about the eyes?
Oh, yeah. So cyclodextrins can also be used in ocular formulations,
Okay.
like eye drops.
Okay.
And they can be really useful for enhancing drug penetration into the eye.
Okay.
So they can increase the water solubility of the drug.
Okay.
They can improve the stability of the drug, and they can even reduce local irritation.
Okay.
And the way they work is by, helping to carry these lipophilic drugs, meaning drugs that don't like water, through that aqueous mucin layer that's on the surface of your eye.
Okay.
And alpha-cyclodextrin in particular, it may facilitate drug transport through the corneal layers.
Okay.
And it could actually directly interfere with the membrane structures and increase permeability.
Yeah.
But there are some safety concerns.
Okay.
So studies in rabbits have shown that 4% alpha-cyclodextrin and 5% RMPCD can be toxic to the corneal epithelium.
Okay.
But solutions of 10% SBECD and 12.5% HPCD were found to be non-toxic and non-irritating.
Okay, so once again, it's really dependent on the type of cyclodextrin and the concentration.
Exactly.
Okay. So let's get to probably the biggest concern here, which is intravenous administration and renal toxicity.
Yeah.
So what happens when these things get into our bloodstreams and, how do our kidneys deal with them?
Yeah, so when cyclodextrins are given intravenously, they're rapidly cleared from the circulation, and they're excreted intact by the kidneys,
Okay.
primarily through glomerular filtration.
Okay, and what does that mean for you?
So basically what it means is that the cyclodextrins are small enough to pass through the filters in your kidneys, and they end up in your urine.
Sure.
They tend to distribute mainly in the extracellular compartments, so they're not really stored in any particular organs.
Okay.
And they have a fairly short half-life.
Okay.
So for HPCV and SBECD, the half-life is typically 20 to 100 minutes.
Okay.
RMESCD has a longer half-life. It's about 7 hours.
Okay.
And that's thought to be because it interacts more with cellular membranes.
Okay, interesting. So what are the concerns then with renal toxicity?
Well, the main concern is that at high concentrations, cyclodextrins can potentially cause kidney damage.
Okay.
And this is thought to be due to a mechanism called osmotic nephrosis.
Okay. And what does that mean for you?
So basically what happens is that when there's a high concentration of a substance in the renal tubules, which are the tiny little tubes in your kidneys,
Okay.
it can actually draw water into those tubules and cause damage to the cells.
Okay.
And so this is something that has been seen with certain drugs, and it's also been seen with cyclodextrins.
Okay. And our sources mentioned a specific medication, Sporanox injection, that uses hydroxypropyl beta-cyclodextrin. What we know about the safety of that drug in terms of your renal toxicity?
Yeah, so Sporanox injection is an antifungal medication.
Okay.
And it uses HPV-ECD to solubilize the drug itraconazole.
Okay.
And the product label actually has some specific warnings about renal toxicity.
Okay.
So in patients with a normal renal function, the HPV is cleared pretty quickly. It has a half-life of 1 to 2 hours, and there's no accumulation.
Okay, that's good.
Yeah. But in patients with renal insufficiency, the clearance of HPKCD is reduced.
Okay.
And that can lead to higher exposure and a longer half-life. So, for example, in patients with mild renal insufficiency, the half-life is increased 2-fold.
Okay.
In moderate renal insufficiency, it's increased 4-fold.
Okay.
And in severe renal insufficiency, it's increased 6-fold.
Wow.
Yeah. And so, if you give multiple doses of the drug to a patient with renal insufficiency, it can actually accumulate in the body.
Okay.
And HPCD is removed by hemodialysis, though.
Okay, so that's good.
Yeah. But the product label does recommend using caution in patients with mild to moderate renal impairment.
Okay.
They recommend monitoring serum creatinine.
Okay.
And they also say that switching to the oral capsule should be considered if there's any concern about renal toxicity.
Okay.
And Sporanox injection is actually contraindicated in patients with severe renal impairment.
Okay, so basically, if your kidneys aren't working well, you shouldn't be taking this drug.
Exactly.
Okay. What about for young children? What do we know about the safety of cyclodextrins in kids?
Yeah, so that's a really important point because young children, especially infants under 2 years of age,
Okay.
they have a lower glomerular filtration rate.
Cool.
Meaning that their kidneys aren't as efficient at filtering their blood.
Okay.
And so that means that they could potentially have higher blood levels of cyclodextrins,
Okay.
which could lead to an increased risk of side effects, including extrarenal adverse effects.
Okay.
Now, it's been suggested that because their renal tubular function is also decreased, they might actually have a lower risk of renal toxicity from osmotic pressure.
Okay.
But we don't really know if that's true.
Okay.
And we also don't know if there's any potential for direct tubular cell toxicity that's not related to osmotic pressure in this age group.
Okay.
So, there's just not a lot of data in young children.
Okay.
There have been a few small studies.
Okay.
So, for example, there was a study in neonates who were treated with SBECB.
Okay.
And they didn't show any significant toxicity.
Okay, so that's good.
Yeah. And then there were 2 5-year-olds who tolerated 2,500 milligrams per kilogram of HPCD IV twice weekly for over a year.
Okay.
And then there was another study in infants that showed no harmful effects at 100 milligrams per kilogram per day of HPCD.
Okay.
But overall, the data is very limited.
Okay, so it sounds like, more research is needed in this area.
Absolutely.
Okay.
Yeah.
And it's really interesting because we also have information about vicalidiri, which is another medication that uses a cyclodextrin derivative.
Right.
This one's called beta-dex sulfobutyl ether sodium.
Yeah.
And the label for that drug says that no dosage adjustment is recommended for renal impairment.
Yeah.
So that seems to be kind of contradictory to what we just talked about with Sporanox.
Right. And that just goes to show that you can't make generalizations about cyclodextrins.
Okay.
Even though both of these drugs use a derivative of sulfobutyl ether beta-cyclodextrin. The specific formulation is different. The amount that's used is different. The way the drug is given is different. Right. And so, the safety profile can be very different depending on the specific drug.
Okay, that makes sense.
Yeah.
So what are some of the general recommendations that, we can take away from all this information?
Well, the EMA, the European Medicines Agency,
Okay.
they actually did a background review on cyclodextrins.
Yeah.
And they recommended that information about cyclodextrins should be added to the package leaflet of medicinal products.
Okay, what does that mean for you?
So basically what it means is that when you get a medication, you should be able to read about the cyclodextrins that are in it.
Okay.
And that's because, as we've discussed, they can have some active properties,
Uh-huh.
and they can also have adverse effects at high doses.
Okay.
So even though oral availability is low, high doses can cause those reversible effects like diarrhea and cecal enlargement. They can also influence tissue permeability and the bioavailability of topically administered drugs.
Right.
And then, they can cause those nephrotoxic effects in animals at high systemic exposure.
Right.
And although we don't have a lot of data in humans,
Okay.
it's still something to be aware of.
Okay.
And so because of this limited information and the potential for interactions, the EMA recommends stating the presence of cyclodextrins as a precaution.
Okay.
And they even suggest including the route of administration, the threshold, if any,
Okay.
and specific information for healthcare professionals in the package leaflets.
Okay.
And right now, the current European guideline on excipients, which are inactive ingredients,
Okay.
it doesn't include cyclodextrins,
Okay.
but there's a proposal to include them.
Okay.
And they're suggesting including, the things that I just mentioned.
Okay.
So the route of administration, the threshold, and specific information for healthcare professionals.
Okay. So it sounds like, this is an area that's, still evolving.
Exactly.
And we're learning more about these things all the time.
Yeah, absolutely.
So, to sum up our deep dive on cyclodextrins, I think the big takeaway here is that, how safe they are really depends on the specific type of cyclodextrin that's being used, the route of administration,
Right.
and even your individual health status.
Exactly.
And I think the example of Sporanox versus Veklury is really illustrative because, even though they both contain similar cyclodextrin derivatives,
Yeah.
the recommendations for renal impairment are very different.
Yeah.
And so it just shows you that, you can't make assumptions about these things. You really have to look at the specific product and the specific situation.
Yeah.
Okay, well, that was a really fascinating deep dive. I learned a lot. I hope you did too. And, I think the big question now is, with cyclodextrins becoming more and more common in drug delivery, how can we better understand their long-term safety profile for different patient populations and different routes of administration?
Yeah, that's a great question.
And it also makes you think, what kind of questions should you be asking your doctor about the excipients in your medications?
Yeah, that's a good point.
A lot of times we just focus on the active drug, but maybe we should be paying more attention to those inactive ingredients as well.
Absolutely.
Okay, well, thanks for listening.
Thanks for having me.